is Martine Watkins, and I'm currently the mayor of Santa Cruz. I grew up in Aptos and then moved over here when I was about 18. Been here ever since and love it. My background in education, absolutely, in terms of upstream investments and long-term kind of mindset when thinking about public policy, definitely fuels my passion for getting involved. Working in education, I went to the Leon and Sylvia Panetta Institute for Public Policy down at CSUMB and received my master's in public policy. And so the combination kind of led me to really wanting to stay engaged, to be involved civilly and trying to be part of the solution. I've overseen in education is tobacco prevention and working with our schools to have good policies in place. Helping various sort of subpopulations. So in student services, we have our foster youth program, a lot of homeless services, and then other ways that we can support our districts. So currently I'm working with early childhood, birth kind of to age 5, and then just most recently completed a grant working on how to get the GED program and the high school diploma program into the jails. It's called Health in All Policies, so it's a public health framework. I was talking a little bit about it actually when we were running for council. It's really looking at how local government influences sort of the health and well-being of our residents. Not to say that we do public health, because we don't have a public health department, but we influence the health and well-being of our community with our decisions that we make. And essentially what that framework does is it helps to sort of set the overarching emphasis around how we can work with our community partners to influence the health and well-being of our community. I think we all value a diversity of people here in Santa Cruz. We want people to be able to live through their stages of life, to have an opportunity to be single here, to grow up and to then maybe have a family and have a career and to age here and maybe have an opportunity for their kids to be here. And if that's our value, then we have to think about how we're meeting those needs. We have to be mindful about having policies that reflect those values. And I think part of that is also what the Health in All Policies framework does, is that if you're thinking about a sustainable community and you're thinking about walkable communities and you're thinking about affordable housing, it equates to how you think about transportation, it equates to how you think about planning, development, and housing. And they're not necessarily incompatible, they should be complementary. Being data-driven and understanding where and what we have and what we need and where we're seeing the impact and the influences that we want to see from our investments, that's government accountability. So I think it's important for us to maintain that. The other is expanding kind of our role and understanding our role within our various partnerships to meet these needs. We alone aren't going to solve all of the different issues, but we, in partnership with different kinds of other community-based organizations and private sector, have to expand our role in seeing our shared responsibility for some of the things that we want to tackle. And we can be proactive in terms of balancing sort of our expenditures and our revenue and thinking about moving forward in terms of revenue measures. And then, so really thinking about how to be proactive and engage in the community along the way. I mean, we want the community to help us understand what they value and need, and then in return we can think about how we want to come up with the resources to meet those needs. It also moves us from a place of kind of a crisis response to thinking about long-term planning, which is a good place to be.